Okay, so for module 12, we're going to be doing ranges of motion, which is active, passive, and resistive. We're going to palpate the bony landmarks and the soft tissue landmarks, and we're going to do the neurological and vascular testing. Okay, so we're gonna start on the anterior side of the elbow, which is right here. We're gonna just start like anterior, then posterior, then medial, then lateral. So then on the anterior side, you're gonna palpate the biceps tendon, which is like right here. And then you're gonna move down to the cubital fossa, which is the inside of your elbow. And then you're gonna do the flexors, the muscles right here, which help with pronation and flexion and like extension. So you're gonna palpate the pronator teres. If you would just do like this, like this. My mom has it, and you just follow it up and you palpate it. And then you palpate the flexor carpi radialis. And actually, when you do this, it does the palmaris longus. I don't have one. Am I right? I don't have that muscle. And you palpate all of these, which is that muscle leads to the palmaris longus. So this side right here is the pronator teres. And then the flexor carpi radialis and the flexor carpi ulnis. Yeah, the ulna is on the side. No, radius on the side. We'll just go with it. Okay, and then on the posterior side, which is like the back of your elbow, you're gonna palpate the olecranian process along with the olecranian fossa. And then you're gonna palpate the triceps brachii, which is like opposite of the biceps brachii, so it's like right above the olecranian process. And you're gonna palpate you can't really palpate the ulnar nerve, but it's back here. And then you're gonna palpate the I can't pronounce it, the ancurius. Can't pronounce half the muscles. And then you're also gonna palpate the wrist extensors, which is the extensor carpi ulnis. It's on this side, I think. And then the extensor carpi radialis brevis, which is back here too. The extensor carpi radialis longus, back here somewhere. And then the extensor carpi radialis, I already said that one. And then, yeah. And then you're gonna move to the medial and posterior side. Just skip those. And then, so this is the medial side, so you're gonna palpate the ulna. Yeah. And then the medial epicondyle, which is right back here. And then on the lateral side, you're gonna palpate the lateral epicondyle and the radial head. So next we're gonna do dermatomes and myotomes. So dermatome, I'm just gonna ask you something feels the same.
Okay.
Something. So does this, close your eyes. Does this feel the same as this?
Yes.
Okay. Go like this. Does this feel the same as this?
Yes.
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 Okay, you can open your eyes now. Okay, so to test, we did C6, C5, C6, C7, C8, and T1. So to test those, you're gonna, okay, for C6, can you go like this? And you should be resisting them, really, ideally. And then C8, go down. Just do one. Okay. And then C8, that was C7. C8, can you do a thumbs up? Okay, now do it. Okay, and then T1, go like this. And then you like just move their fingers together. I have to do it, you can't do it. Okay. So now we're gonna do ranges of motion, which is active, passive, and resistive. So for active range of motion, you're gonna have your elbows like this, and then you're just gonna bring them up to your shoulders. And then that's it, flexion, and then extension, you're just gonna bring them back down. And ideally, if you have, I don't have a goniometer, but if you have a goniometer, you're gonna want to put it on the lateral epicondyle with the distal end on the humerus and the movable arm down the shaft of the radius. Same, that's the same one for extension, and then the degrees for it for flexion is 0 to 145, and then for extension they should at least reach 155. Some people can go over 155 just because they have hypermobility in their elbows, like me. Hypermobility. And so then for pronation, supination, you're gonna go like this is pronation, and you're just gonna like twist over. That is supination. For those, you're gonna want to put the fulcrum on the ulnar styloid process. This is the ulna, so you're gonna put it like right here, like the medial epicondyle, and you're gonna put the distal end on the humor. The distal end goes up in the air, and the movable arm goes across their arm. So like when they turn it, it moves it for you. Okay, so now it's resistive. Passive is pretty much the same. Just sit here.
Okay.
Just sit there. Okay, so passive, I do it for so like this, and then like this is pronation, and then this is supination. So now you're gonna want to do resistive. So I'm gonna like hold up here and hold down here, and you're gonna like flex your elbow. No, you go up.
Oh, okay.
Go up. Go like this. No, like this. Okay, now go down. You're not trying. Okay. I'm resisting you, you're not resisting me.
So am I supposed to push against you?
No!
Try to push down.
Yes.
Okay.
And don't let me push you down.
Okay.
Okay, ready? Okay. Don't let me push you up while you're going down. Okay. The best I can do for flexion and extension for resist.
His mother doesn't pay attention.
Okay. So for pronation and supination, I'm going to push against you, and you're gonna go like this.
Okay.
You're just gonna move your arm like this.
Okay.
Where this side is
Up.
Up. This
Okay.
is your anterior side. You want this up.
Okay.
Okay. Go. Okay. So now you want the anterior side down.
Okay.
And let me push against you. Okay. 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 So now I'm gonna do, it's the valgus and varus stress test.
Okay.
So you're sitting there, and then your shoulder is in neutral, and your elbow is at 10 to 15. We're just gonna do it right there. So then you're gonna wanna hold the patient's wrist, and your other hand is going to be on, let me try this on the medial side, and you're gonna like go like this, and just add like that force to it. And a positive test means like if your elbow just popped out of place. So like more laxity is a positive test. So then with the varus, you're gonna pretty much do the same thing, but you're gonna do it like, I just did a varus. Frick. That was the varus. This is a valgus. And you're pretty much like, don't move your arm. I move it for you. And yeah, you pretty much go like that. You push on one side and pull on the other. pretty much what you do, but it just happens on where you stand. The varus, you stand on the medial side, and with the valgus, you stand on the lateral side. Okay. That's all I have. So, now we're going to move to lateral epicondylitis. Actually, no, we're going to do the pinch grip test.
Okay.
So you take your index finger and your thumb and you pinch them together. You can obviously do that so you have a negative test, and if a positive test indicates that there's something wrong with the anterior costal nerve, which like some people can't do this. Okay, and so then the Tinel's test, you're gonna stay seated and your elbow is slightly flexed, and then you stand on this side and do it this way. And does that hurt?
No.
Okay. You tap under like where the ulnar nerve will be, and if it's positive, there's tingling down the arm. Did you feel any tingling?
No.
If you don't feel any tingling or pain, it is negative.
Awesome.
So then the last one is the Primary teres syndrome, which is compression of the median nerve. So really, you're gonna have your elbow close to your side, and I'm gonna do this elbow, and you're gonna like pronate. So you're gonna go like this, but I'm resisting you. You ready? No, you go that way. And you pronate. You go like this. There you go. And that was negative. Okay, that's all I have. Actually, no, we're going to do the pinch grip test.
Okay.
So you take your index finger and your thumb and you pinch them together. You can obviously do that so you have a negative test. And if a positive test indicates that there's something wrong with the anterior costal nerve, which like some people can't do this. Okay, and so then the Tinel's test, you're gonna stay seated and your elbow is slightly flexed, and then you stand on this side and do it this way. And does that hurt?
No.
Okay, you tap under like where the ulnar nerve will be, and if it's positive, there's tingling down the arm. Did you feel any tingling?
No.
If you don't feel any tingling or pain, it is negative.
Awesome.
So then the last one is the Primary teres syndrome, which is compression of the median nerve. So really, you're gonna have your elbow close to your side, and I'm gonna do this elbow, and you're gonna like pronate. So you're gonna go like this, but I'm resisting you. You ready? No, you go that way. And you pronate. You go like this. There you go. And that was negative. Okay, that's all I have.
Go.
Okay, so now we're going to check for lateral epicondylitis, and what the test you would do that for is the tennis elbow test, and I'm just going to do the one that's in our main like ortho book. And so what you're going to do, you're going to have your patient sit down, and you're going to stand laterally to them, which is like on the outside of their arm. You're going to want to have their arm pronated, which this side is up, and their arm at 90, and you're going to palpate the lateral epicondyle. And then their fingers are going to be flexed, and you're going to risk like extension as they're doing it, but you're resisting. Okay. And a positive test is if they have pain. Did you have any pain? No. There you go. Okay. You can stop.
Go.
Okay. So next we're going to look for medial epicondylitis. And the test for that is a golfer's elbow. So you're going to have your patient sit or stand. She is sitting. And you're going to want to palpate on the lateral. You're going to have them make a fist. And you're going to palpate on the medial epicondyle, which is right here. And my hand is going to be right here. And I'm going to passively supinate them and extend their elbow and wrist. So we go like this. Really? I can just hold your hand. And a positive finding is if they have tingling or pain that radiates down their arm. I had none. She is negative. Okay, so I'm going to talk about an ulnar, like the functional and activity related tests. So the thing I have a baseball player. I picked baseball as the sport, and we're going to go ahead and do pitcher. And I'm choosing the injury to be an ulnar collateral ligament sprain. And that's an acute thing, and it happens on the medial side of the elbow, and it's from repeated overhead activities, i.e. throwing. So I decided for like a functional assessment would just be the valgus stress test, a valgus and varus stress test, even though it is a varus load on it, but you want to rule out any other issues with the varus stress test. And then you want to keep them in the training room, and for a functional assessment, you can see if they're good at throwing underhand and maybe overhand without any pain. You want to do any like ranges of motion to help strengthen the muscle, the ligament. And then the functional test is you want to take them out to the baseball field on the mound and have them throw to you, have them throw to other, like the first baseman, the second baseman, outfield, to the catcher, any sort of throwing that you could think of having the baseball player throw. You want to have them keep throwing even after they're done. And when they're waiting for their turn to pitch during a game, you want to have them throw in the bullpen, and you just want to monitor it. You want to also have them rest and use cryotherapy.